Hello students, myself Dr. Ambika, Associate Professor from Department of Oral Pathology and Oral Microbiology. I'll be talking about tooth numbering system today. The contents of my presentation are dental formula and why do we need tooth numbering system and what are the different types of tooth numbering system, details of those numbering system and other types of numbering system. So first we'll see about dental formula. Dental formula, it's actually a shorthand way of representing the different types of teeth in each quadrant. So in each quadrant there are different types of teeth. This is the quadrant, midline of the quadrants, all the four quadrants, and the first teeth is incisor, lateral incisor, central incisor, lateral incisor, canine, premolars and followed by molars in case of permanent dentition, whereas in permanent dentition it is central incisors, lateral incisors, canine and molars, first and second molars. Okay, and in formula, dental formula, each tooth is represented by the initial letter of its name, and also understanding the dental formula lays the foundation for mastering tooth identification and numbering systems. So as I told you, each letter is given an initial letter, like incisor means I and canine means C, premolar P and molar M. Okay, so this for deciduous dentition, so we'll be giving like incisor. So as I told you earlier, only one side of the jaw we'll be considering while writing the dental formula. So two incisors in the upper jaw and two in the lower jaw, and canine one in the upper jaw and one in the lower jaw, and molars there are two molars, so two in the upper jaw and two in the lower jaw. So totally there are how many teeth in the upper jaw? There are 5 teeth. So 5 in the upper and 5 in the lower. So totally there are 10 teeth. Okay. So in a one side of the arch there are totally 10 teeth are present in case of a deciduous dentition. So for permanent teeth, similarly, so incisors there are 2 in number, that is central incisor and lateral incisor. So 2 in the upper and 2 in the lower, and canine there is 1 in the upper and 1 in the lower, and premolars there is 2 in the upper, that is first and second premolar in the upper and the lower jaw, and there are 3 molars like first and second third molar. So 3 molars in the upper, 3 molars in the lower jaw. So in each quadrant how many teeth are there? Yes, 8 teeth. So 8 in the upper and 8 in the lower. So totally there are 16 teeth on one side, considering upper and lower jaw in total. So overall there are in all the 4 quadrants there are 32 number of teeth, right? So this is the dental formula represented for primary and permanent dentition. So next, why we need tooth numbering system? So tooth numbering system is mainly used for communication purpose, and also it can also be used for a shorthand system for recording purpose as a data or a file record. So it can be used for storing purpose also. So this is why we need a tooth numbering system. So it can be adopted as a code or a numbering system for a teeth. So there are totally 3 types of numbering system, main types of tooth numbering system, like universal notation, Zsigmondy or Palmer notation system, and Federation Dentale International. First we'll see about universal notation system. So universal notation system, capital letters are used for describing primary teeth, and for permanent dentition numbers are being used. Okay. So ADA put forth this numbering system in 1968 and recommended the universal numbering system officially. So as I told you, capital letters are used for primary dentition. It usually starts from the right side, right quadrant, maxillary right quadrant, and the alphabet starts from A through J. So A, B, C, D, E. So in per quadrant 5 teeth are present. So A, B, C, D, E, and it continues to the left quadrant F, G, H, I, J. So in maxilla A to J. Okay, and followed by mandible, it continues in the mandibular left second molar. It occurs like in a cycle. Okay, so after J, it continues in the mandibular second molar as K, L, M, N, O, P till T. Okay, it ends in mandibular right second molar, starts from maxillary right second molar and ends in mandibular right second molar. So in universal notation for primary dentition, capital letters or capital alphabets are being used for representing the tooth numbers. Okay, so in universal system, according for permanent dentition, numbers are being given. So here also the tooth numbering system starts from maxillary right third molar and it ends in mandibular right third molar. Okay, it starts from 1 to 16. It may be one side or in both the quadrants. There are totally 16 number of teeth, right? 8 in each quadrant. So 1 to 16 starts from right maxillary third molar and ends in maxillary left third molar, and it continues, the 17 continues in a cyclic way. Okay, so continues with left mandibular third molar and continues to the mandibular right third molar. Okay, so numbers are given for permanent teeth, and here 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It is pronounced like 11, 12 and 13 for universal notation, which will be different for other numbering system. Okay, so in this system, each and every teeth are given numbers. Even the wisdom teeth is given a number. So if it is missing also, that respective teeth will be given a number. Okay, even if it is removed also, the teeth will be numbered as well. So advantages include separate alphabet or number is given for individual teeth and it is easy to visualize. And disadvantages is that it is confusing when comparing with the Palmer notation, and also the same type of teeth in different quadrants is represented by different alphabets or different numbers. Okay, for example 11 will be maxillary left canine. Okay, the same canine in mandible, it will be represented by 22. So this is the confusion. Same canine will be represented as different numbers or alphabets, so it is quite complicated to keep in mind. So it is confusing and difficult to remember. So it does not consider the jaw quadrant clearly. The similar teeth are given various numerous in different quadrants. So in universal numbering system, primary and permanent, they are given alphabets and permanent numbers are being used. Okay, and next coming to Zsigmondy-Palmer notation. Zsigmondy-Palmer notation mainly use grids like these are the grids. Okay, like for representing the quadrants, or whether it is upper right or left or lower right or left. Okay, initially Zsigmondy used Roman numerals 1, 2 and 3, 4, 5. Okay, and later Palmer changed to uppercase capital letter for primary dentition. Here all the teeth in every quadrant are given the same alphabets like A, B, C, D, E. Okay, A represents central incisors, B represents lateral, and C canine, D first molar and E second molar. So it will be same for all the 4 quadrants. Okay, so by using this grids only we can represent whether it is right or left or upper right or lower left. Okay, so whether it is maxilla, mandible or right or left can be denoted with the help of these grids only. So it is, hence we are using symbols like these. It is also known as symbolic system. Okay, for permanent dentition numbers has been denoted. So 1 to 8 numbers are being given. So 1, 2, 3, 1, 2 represent the incisors, 3 represent canine, 4, 5 represents the premolars, 6, 7, 8 represents the molars. So this is the right side and this is the left side. Okay, so if we represent it as 3, it denotes right maxillary canine. Okay, so this is about Zsigmondy-Palmer, and comparative to other systems, the system is simple to use and easy for beginners due to less confusion, as permanent teeth and deciduous teeth are indicated differently, and also the same type of teeth is denoted by same uppercase or numbers in all the 4 quadrants. So this is actually an advantage of using Zsigmondy-Palmer notation. Disadvantage is that there is no differentiation between right upper lower or left upper or lower. If we miss the using of grids or symbols, then it is difficult to identify which type of tooth it is, right? If I simply mention it as A, it will be difficult to denote which side is this or which quadrant it is, upper or lower or right or left. Okay, segments has only one number and used to designate particular tooth, and no provision to identify supernumerary teeth or missing teeth, and it is difficult for verbal communication also. So these are the disadvantages of Zsigmondy and Palmer notation. So next we will see about Federation Dentire International or FDI numbering system. It is also known as 2-digit numbering system because here for each tooth 2 numbers are given. The first number denotes which quadrant it is and the second number denotes which type of tooth it is. So it was first proposed by FDI, okay, and it was adopted by WHO and other organization and was commonly accepted tooth number universally. Okay, as I told you, the first digit of each represents each quadrant and the second digit indicates the type of the tooth. For primary dentition, the first digit is 5, 6, 7, 8. 5 denotes upper right quadrant and 6 denote upper left and 7 denote lower left and 8 denotes lower right. Okay, so and the second number will be uniform like 1 to 5. So 1 to 5, right? 5 teeth in each quadrant. So 1 to 5. So it denotes 6-1 denotes upper left incisor, okay, and 6-2 denotes upper left lateral incisor, 6-3 denotes upper left canine. Okay, so this is how you have to pronounce also. Earlier I told you, right, in universal numbering system you have to mention as 11, 12, whereas in FDI numbering system you should not mention as 61, 62, 63. Okay, you have to mention as 61, 62 because each digit in for a particular tooth is has a different role. Like first digit denotes the quadrant and second digit denotes the type of teeth. Okay, so this is for primary dentition according to FDI numbering system. Okay, 5, 6, 7, 8 and the second digit 1 to 5 common. Okay, for each quadrant. For coming to permanent dentition, so for permanent dentition the quadrant number is 1, 2, 3, 4 in a cyclic way, like 1, 2, 3, 4. 1 represents upper right and 2 represents upper left and 3 represents lower left and 4 represents lower right. Okay, and here for each quadrant there is 8 teeth are present. So the tooth number will be running from 1 to 8. Okay, so this is how it will be represented for each quadrant. So 1, 1 represents upper right quadrant, that is central incisor. So 1 and 2 will be representing incisors and 3 will be represented by canine and 4 and 5 will be represented as premolars. 6, 7, 8 will be represented as molars. Okay, so advantages of using FDI numbering system: it is very simple, accurate and easy to memorize, and it is also user friendly and prevents error in differentiating right and left quadrant and which type of teeth it is. It is simple to teach and easy to understand also, and simple to translate and input in computer, and it's simple to converse and make conversation with others, and it is readily communicable. Disadvantage is that it is time consuming, needs much concentration and difficult to enter multiple teeth in different arches, and it would be too long to use routinely like in case sheets. Okay, so compared to Palmer notation, this system is not accurate and creates confusion compared to Palmer notation, because Palmer system is very simple to use and can be used in day-to-day practice. Okay, so other numbering system includes Hillischer's tooth numbering system, Mons Dubious numbering system, Victor Hederup system, Wolfeld system, Freycombe and Lysel system, MyCap notation, Havel's alphanumeric dental notation. So these are the other numbering system. So to conclude, there are 3 important numbering systems like universal numbering system, Zsigmondy and Palmer notation, and FDI numbering system. Numbering system mainly used for the purpose of communication and also for recording or storing it as data for future reference. So these are the use of tooth numbering system. Okay, thank you for watching my video.